Hi, I'm Dr. Beyer, Beyer Functional Wellness in Mokina. Wanted to shoot a video about some of the top reasons why someone would want to consider bioidentical hormone replacement therapy. And I'm going to kind of keep it simple and narrow it down to four main reasons. The first is that hormones are the most powerful chemical messengers in our body. They're chemicals that signal the cells to do certain things. And when hormone levels are too low or too high, then it dramatically negatively affects our overall health and quality of life. On my website, I list a number of health issues which women particularly are at less risk for when they undergo proper hormone replacement therapy. For example, the risk of Alzheimer's disease, cardiovascular disease, heart attacks, strokes, the risk of osteoporosis with resulting hip fractures, as well as many other things, are dramatically reduced when women at the appropriate time go on hormone therapy. And there's just no reason to suffer with, in addition to a decreased risk of these issues, there's just no reason to suffer with a decreased quality of life. Energy levels being improved when hormone therapy is done correctly. Sleep is improved, a number of other things. Sexual wellness, libido is increased. So there's just no reason to suffer for the age-related diminishment in hormones when, if done the right way, hormone therapy not only can improve the quality of life, but increase, or rather decrease, the risk of certain health issues. Like I said, Alzheimer's disease and cardiovascular disease and so forth. The issue that people have, though, is they've been scared by hormone, particularly women, by hormone therapy because of the results of some studies that were done with synthetic hormones. And that's the big difference between bioidentical hormone replacement therapy and traditional hormone replacement therapy is with traditional hormone replacement, synthetic hormones are used, and hormones are chemicals, and so they have a particular structure to them. The example I give is kind of like a key with a certain number and pattern of notches, and a synthetic hormone, the number and pattern of notches is not the exact same as the hormone that our body naturally produces. But with bioidentical hormones, the pattern, the chemical structure of that hormone is the exact same as the hormone that our body naturally produces. So when you change the chemical structure of a hormone just a little bit, then you're going to have the potential for unwanted negative side effects, which is what happened when studies were done using synthetic hormones. And the studies that came out with what's called the Women's Health Initiative. And unfortunately, the negative misconceptions about hormone replacement therapy just persist because of that study, even though it was in large part debunked. But one of the main reasons why there was some negatives is because of synthetic hormones being used, as well as, and this leads to the third issue I want to talk about, which is when you do bioidentical hormone replacement therapy as opposed to synthetic, it's going to be a balanced hormone approach, meaning one of the reasons why there were some negative effects with the results demonstrated from the Women's Health Initiative was because estrogen therapy or intervention was given not coupled with progesterone, and that can lead to some negatives. When bioidentical hormone replacement therapy is done, there's always a coupling. Progesterone has a great protective effect to estrogen. So estrogen levels drop in women as they go through menopause, and elevating those estrogen levels can be beneficial, but to couple the estrogen supplementation or therapy with the appropriate amount of progesterone gives a great protective effect. In addition, most women are dropping in progesterone levels also. So there's a balanced approach with practitioners who do bioidentical hormone replacement. So not only is the hormone that's being delivered to the patient the exact same chemical structure as what our body makes, but there's always a consideration for a balance approach. Hormones are not given in isolation, in other words, and our body responds much more positively when a balanced approach is used. And then the fourth thing I want to cover in this video is that in my clinic, we do functional medicine along with bioidentical hormone replacement therapy. And what I mean by that is that we kind of cover the foundational issues first. How is a person regulating blood sugar? How is there a lot of inflammation in their system? How are they absorbing nutrients? Are there gut issues? So there's always the intervention to correct those issues as a foundational approach to set the stage for a more positive response to the bioidentical hormones that are prescribed to the patient. So the hormone therapy, as beneficial as it is, because hormones are powerful chemical messengers, and we're using bioidentical hormones that are coupled and balanced in the right ratio. But the response is even better with most of our patients compared to other clinics, because we're not just doing the bioidentical hormone therapy in isolation. We're making sure all those other really important, significant, fundamental issues are being looked at and corrected if there's a problem, such as blood sugar irregularities, adrenal dysfunction, other hormone levels like thyroid and things like that, nutrient absorption, gut-related issues. So we take a very balanced approach and get really, really good results, not just because of the way that we do the hormone therapy, but how we're coupling it with a good foundational functional medicine approach. But those are four of the things I wanted to cover of why someone would consider bioidentical hormone replacement therapy. It's hormones are very powerful chemical messengers. With bioidentical, it's the same chemical structure. The hormone that you're putting into the body as what our body makes. It's balanced with other hormones, and then in our clinic, we couple it with functional medicine too.